The last 6 years of Gombe State Governor Inuwa Yahaya's tenure has been dedicated to fixing challenges inherited in the healthcare sector by declaring a state of emergency on healthcare. Within this period, the state government constructed 228 primary healthcare centers, 2 in each of the 114 political wards of the state. 3 state-of-the-art secondary hospitals equipped with cutting-edge equipment in the 3 senatorial districts. Kumo Hospital was converted to Federal Medical Center by President Bola Tinubu in October 2025. The 100% implementation of the Consolidated Health Salary Structure CONHESS and Consolidated Medical Salary Structure CONMESS, which was deemed the missing piece in Governor Inuwa's revitalization drive, is now a reality as reflected in November salary payments, sparking renewed enthusiasm among health workers in the state.
Right now, if you go to our facilities, you see change. You see how people are committed to work. Before they are a little docile, they are a little complacent in the work. But now we told them rosters must be made. Every person must be punctual, and you must stay throughout the work hours. And like I said, even off work hours, when there are emergencies, a health worker doesn't know a work hour is around the clock. So they are full of energy, full of excitement to ensure that they provide service because their welfare is addressed.
The November implementation of Consolidated Health Salary Structure CONHESS, which is a composite salary and allowance bundle for nurses, pharmacists, radiographers, and other health workers, has raised the morale and industry of health workers.
During the recently concluded Health Summit, that is Gombe Health Summit, when the government pronounced it, that called for a greater jubilation. But the joy became more certain and complete when the salary came up, that when the government kept to his promise of November salary, he will pay with the 100%. So when the news came up, it was a groundbreaking thing.
If you went around, you will see an uninterrupted supplies of essential medicines and medical commodities in the health facility. And you know, we cannot stop hailing His Excellency, and we are all fully motivated. We have come out en masse to support this administration fully.
For the medical doctors, CONMESS is described as a panacea for brain drain that had shrunk the number of doctors within the state government's employ.
You know, when you talk about brain drain, most people think doctors leaving Nigeria and traveling outside to practice. Essentially, the biggest part of brain drain is happening within states. Within a year, more than 60-something doctors left the state establishment, the service, and moved to the federal services. So this invisible movement, although has not changed the number of doctors that are working in Gombe, but it has significantly shifted the amount of doctors that are working for the state and are available for the state hospitals. We strongly believe that this approval and implementation of CONMESS will reverse this trend, and it will give so many doctors who are willing to stay in the state and work, it will give them the necessary support to remain where they are and serve our people.
While expressing gratitude for the renewed commitment to delivering first-rate healthcare services across all facilities, health workers say the ultimate beneficiaries of the new salary structure are the over 4 million residents of Gombe State who access healthcare services on a daily basis.